I'm presenting today the result of an in-depth survey that the Foundation have done on some of our adult patients to help better understand the disease, particularly the natural history of the disease. So what is our current understanding? To recap, we have sort of a staged presentation with the infants, the silent period, and the adult and adolescent with some severe phenotype, as Julian mentioned before. The current understanding also is that there's no one universal symptom. It's very diverse symptom, and the natural history is also not very well understood. So the Foundation then go into this with a question: is the silent period really silent? Are there really universal symptoms across patients? And what is it like to live with citrin deficiency, especially among adult patients? And the reason why we have all this question in mind is because through our 10 years of work, we heard so many stories from our patients, from clinicians around the world that just doesn't quite sit with the published literature sometimes. So what did we do to try to understand this better? We then decide a patient lived experience survey. The way we do it is that we look at the existing publications. We collect all the evidence from our interactions with patient clinicians. We then have questions, about 60 of them, to cover all domains of the disease, from symptoms to clinical to lived experience to, quality of life. And then we sit down with patients for about 2 to 3 hours to have sort of a semi-structured interview where they are asked to answer the question, but they're also given the opportunity to elaborate, to add more with open-ended discussion. And the idea is that we can then generate very rich data which help us to understand the disease more. From these rich data, we extract themes that are relevant to all the patients, themes that may be overlooked or hidden, that's not in the published literature. And we are very grateful and fortunate that we have 7 adult patients globally who participated in this. And the reason why we choose adult patients is because 1, they're less studied in the literature. 2, we think that they are very well equipped to self-articulate their lived experience and symptoms. So what did we find? We found that actually there are maybe universal symptoms, and the first one is carbohydrate trigger symptoms. Patients told us that they experience symptoms triggered by eating too much carbohydrate above their usual amount. And the symptom that they have is not just a behavioral aversion, but pretty much a physiological response. And this physiological response includes fatigue, abdominal pain, nausea, feeling unwell, and even high ammonia. I would just use the patient's word to illustrate the point. When I was little, eating too much carbohydrate would cause pain in my upper abdomen. It felt uncomfortable and unsettling. I would get nausea in both my chest and stomach, similar to feeling sick and on the verge of vomiting when I eat too much carbohydrate. Now, this has not been published in the literature because we just hear food aversion, but we have not heard symptom-triggered response. The second thing we found is fatigue. This is really interesting. We found that patients all experience some kind of fatigue. And now this is really tricky because we found both physical and mental fatigue, but we also find that it's quite hard to take it out of patients because when you ask them, they will all say, I'm fine. And the reason is because they are born with this condition. And don't forget, the moment that you're born with citrin deficiency. So your normal level of fatigue is what you experience. You don't really have a healthy baseline to compare with. And it's really through in-depth conversation. We ask, how often do you rest? Do you have time in the day where you really feel a dip in your energy and you cannot continue? And through conversation like that, we realize, okay, there is indeed fatigue among our cohort. And I would just use some patient code to illustrate a point. Currently, in the evening and at night, I feel like I need a lot of sleep to recover from fatigue. After work, I have to take a nap before I can do anything else, like taking a bath. If I run for about 5 minutes, it significantly impacts my energy level for the rest of the day. I can't function without sleep. Sometimes I end up skipping dinner because I'm too tired to eat. And so when we talk about fatigue, particularly with patients with inborn error of metabolism, meaning you're born with it, we have to be careful about baseline effect and the coping mechanism to really dig deeper to find out, is this really affecting them? And that's what we found. Next, we found that there are under-recognized symptoms, which is the gastric symptoms. Patients often report nausea, acid reflux, bloating, abdominal pain. But what we need to dig deeper in our next phase of studies, is this associated with food or is it independent of it? Just to share that patients do complain of hunger pain, which is in the quote here. I tend to experience abdominal pain when I'm hungry. I have to wait until the peak pass. Otherwise, even if I eat, I end up vomiting. During that time, I drink water, something with no taste. Depending on how I feel that day, I might feel nausea for about 10 minutes. So this is really interesting. Now, we also try to explore the psychological and social impact of living with citrin deficiency, which has not been explored before. What we found is that patients do have a lot of caution around food choices, particularly in a social setting. There is certain uneasiness of explaining their food choices because there's very few awareness of this condition, and people often have difficulty understanding why some young patient, for example, cannot have birthday cake, cannot drink juice. And for older patients, there's a fear of accidental alcohol ingestion in social settings. And there's also the stress regarding whether I would develop a more severe onset of the phenotype. Now here we have the report of the leveled or some of the experience that they experience, which is anxiety, stress, social withdrawal. This is not to say that our patients have anxiety and stress per se. This is to say that they have anxiety and stress associated with living with the condition. And so I think, as parents, it's good to kind of be more aware of that as you helped your child to navigate through that journey. Okay, so what does this mean? Maybe citrin deficiency is like this. Beautiful picture, and your child and also all coping well, looking fine on the surface. But actually, they're walking on a very thin road. And when there is a stress, either eat too much carbohydrate or being sick or strenuous exercise, suddenly you may find that to be off balance and they may have difficulty coping or symptom may emerge. What is the implication for daily management from a patient experience perspective? First, we need to be aware that there are stressors that may cause the disease to worsen. For example, maybe you eat too much carb or sugary food, if you drink alcohol, if you're ill, if you're going through strenuous exercise or activities, or even aging. So what can we do as patients and parents? First, better understanding of yourself and your child. Record down incidences where you have food triggers. What are the symptoms like? Pay attention to your energy levels. Observe pattern. Are you more easily being tired in the morning or maybe late evening? Pay attention if you have other symptoms, maybe headache, limping, lightheadedness. We hear a lot of that in our community. We still don't know whether they are CD related, but we are hearing it. And as parents, you can always compare your two children to see that is there a difference in their pattern of behavior, energy level in particular. Most importantly, tell your doctor what you observe when you go into a clinic. The more you educate a clinical professional, the more they can understand citrin deficiency and the more they can help you to manage the condition and the more we can help to research into it. What are the management strategies that Julian has comprehensively covered? I would just add some tips as a family is that, when you do MCT, try to mix it with food and split it throughout the day so it's easier for patient to digest. Try to have frequent top-up, particularly during illness or strenuous exercise. And try to break down your food into maybe 3 meals and 2 snacks. A big meal may be harder for the patient to digest than a smaller portion to keep the energy running. Now, what is the summary findings of the survey that we talked about so far? First of all, we find that there actually may be possible universal symptoms, which is fatigue and carbohydrate trigger symptoms. There could be under-recognized symptoms such as gastric symptoms. There could be psychological and social impact of living with CD that we may want to pay a bit more attention to help our children and help patients. But the question still remains, are there other symptoms? And we also need to see, are these findings still true in a wider group of patients? I encourage all of you to look into our publication, which has open access, but we need to continue our journey to find out these answers. So what are we doing? We are planning an upcoming wider survey where we will do an online survey only to then ask patients, do you have carbohydrate trigger symptoms? Do you experience fatigue with a validating tool? Do you experience headache, limping? Do you have other symptoms? And what we're trying to get at is trying to develop endpoint that can be used in clinical trials for treatment evaluation, which is ultimately will really help patients. If we find a treatment that can improve fatigue, that can improve headache, improve carb trigger symptom, and it really improve the quality of life of patients. Better understanding of citrin deficiency means better treatment and management, benefit you and your children. So your participation in this survey will make a big difference. So I really, really encourage everyone, when we send a survey, please participate. We need you. So the importance of patient involvement in the rare disease research, we talk about it because it helps clinicians and scientists to understand the condition better. Better research means better treatment, and help yourself to understand your condition better is also lead to better management. And also it could generate evidence to support the approval of new therapies and treatment by regulators and health systems. So it's incredibly important. And there are some past studies that we already have done involving patient participation, such a study to look at the urea cycle function, a multi-omic study to try to find out biomarker, an adult metabolic study to see how the metabolic system in the adult was with a trace isotope. And that's thank you to all your support, and some of you in particular. So how do we engage and help you in return? We have a community now that over 400 patients around 20 countries. We have a peer support group in WhatsApp. You can feel free to join and share experience or ask questions. And there's also international patient committee. We have 8 members across 3 countries. We have a whole lot of resources as patient website resources, online gatherings such as this one. We have community that help us to inform our research priorities. And we also continue to reach patients through our clinical network. So I hope you could join us and register with us and be part of our community. And the progress today at the Foundation is that we fund 18 fundamental science projects, 16 translational science projects, developing 9 preclinical models, and we fund 7 projects and is growing to develop or evaluate treatment. So with that, I would like to thank everyone, patients and family, particularly those participating in the survey in some of our studies, our team, and our collaborators and advisors. So thank you for listening.